Hi everyone. In this lecture, I will be going over using EBP in therapy. I'll introduce the steps of EBP and then describe how to use EBP in each phase of therapy and why it matters. So first, the steps. So number one is ask, which basically means you're going to start where the client is. This is your assessment process where you're gathering the information that you need in order to determine what they need and want from therapy. This is also where you're getting to use everything that you learned in your assessment course in order to complete a thorough mental health assessment, including whatever that would normally include for you. And you're wanting to identify at the end of this what the client wants for therapy and which issues you're going to want to address throughout the therapy process. Step two is acquire, and this is what evidence and theory exists to explain or address the situation. So this involves reading articles and books, going to trainings, attending group supervision and individual supervision in order to gather the information that's already available. This is your research process in a sense. Next, number three is appraise. And here you're asking, what is the best information about what will work best? And here is where you are using the research hierarchies, which we'll go over next week, and where the answers and the types of data you access are going to depend on the type of question you're trying to answer. I know that sounds kind of complicated right now, but basically you want to figure out what am I trying to figure out and what is the best evidence to use to figure that out. Next is apply, and this is where you're actually implementing the best choice. And you can think of this almost as treatment planning, right? So figuring out, now that you know what the goals are, how are you going to approach accomplishing or meeting those goals? Next is analyze and adjust. And here you're asking, did it work? And this involves tracking mental health outcomes and is why you need to use SMART objectives and self-report measures in order to see if what you're doing is making a difference. If you didn't make a difference, not if you didn't make a difference, but if it didn't accomplish the goals, you're going to want to explore the potential reasons why, and then use the research to find an alternative approach. All right, so when we think about EBP, it often gets pigeonholed into solely thinking about interventions, meaning which interventions do I use to treat XYZ? But in reality, EBP should be happening at every phase of the treatment process. And in this course, I'm going to help you to use EBP at each stage of the treatment process by going over each one each week. So to help illustrate this, I'm going to introduce you to a case that we'll be referencing throughout the course. And it's one that you're likely familiar with if you've taken previous courses with me. So the case is that of Miguel. So Miguel is a 9-year-old Mexican-American male who was born and raised in the central LA area. He lives with his mother, 2 grandparents, 2 older brothers, and a younger sister. Miguel was referred to therapy by his teacher due to physical and verbal aggression that included arguments and fighting. And during the intake session with you, Miguel's mother, Luisa, reported that Miguel is also aggressive at home with his siblings and explained that his physical and verbal aggression occurs about 2 times per day, every day. She informed you that these behaviors, as well as fear of and hate toward police, began after Miguel witnessed his father's unexpected and violent arrest 9 months ago. She shared that Miguel has trouble sleeping due to nightmares about his father being hurt by police or his mother being taken away by police. He also becomes extremely anxious whenever he has to be away from his mother. According to Miguel's mother, Miguel is close to being expelled from school. Okay, so first, assessment. What does the research say is the best approach to assessment with this particular client under these specific circumstances? Is it using a self-report measure, a psychiatric interview, observation, a combination, etc.? And this is going to look at things like reliability. Is your assessment tool consistent? Validity. Is your assessment tool measuring what it's supposed to? Is it sensitive, meaning that it's going to pick up on small but important changes? Is it feasible? So this assessment isn't going to take 1,000 hours. And is it culturally sensitive? So looking at things like language, for example. In the case of Miguel, using a self-report measure is not going to be very helpful because he's only 9, right? And the information he gives you on that measure probably isn't going to be all that helpful. So in his case, we'd probably want to have multiple informants, Miguel, his mom, his teacher, and we're probably going to do a psychiatric interview or a mental health interview, as well as some observation in the home or in the classroom to get a really thorough assessment. Next is the Therapeutic Alliance. And here we're trying to figure out what are the best practices for building a therapeutic alliance with the client. We know that the Therapeutic Alliance is one of the most important predictors of therapy efficacy. So we would want to know what are the best ways to build it. And this includes which therapist characteristics are ideal, for example. With Miguel, providing a safe environment and joining with him through things like games and art may be the best way to build a relationship. We'd also want to research alliance building with school-aged children to find out more about what we can do. Next is diagnosing. So in the previous lecture, I mentioned that different disorders may manifest differently in different people. And if you're unaware of this, you may misdiagnose and fail to understand what the client is really experiencing. For example, we'll learn later about research that shows that children with PTSD tend to show less avoidance symptoms and more behavioral symptoms, which is consistent with what we see in Miguel and his aggression. If you didn't know this, you might misdiagnose him with a behavioral disorder rather than a trauma-related disorder. Next, treatment approach and interventions. So which intervention program or policy has the best effects? This is the most common question for therapists, but remember, it's not the only one. And we want to know which approach or intervention is going to bring about change for the client. This depends on the specific issues, how they're manifesting, the client's characteristics, and the specific treatment circumstances. Note that even the most effective intervention might not work for everyone. Further, there's no point in having a super effective intervention if you can't afford to implement it or it just isn't feasible. For example, interventions like MAP, the evidence-based treatment MAP, costs about $3,000 to be trained in. So unless you have an agency that's going to pay to get you trained, even if that's the perfect intervention, you might not be able to provide it. You also want to consider here, are there potential harmful effects of certain interventions? Recall that our code of ethics requires us to do no harm. And some interventions have been found to be ineffective and harmful. I've already mentioned the Scared Straight programs. There's also something called critical incident stress debrief that is found to not really be helpful. And then other approaches that are helpful aren't in certain circumstances, like psychodynamic psychotherapy for schizophrenia, for example. So we want to keep that in mind and also remember that some treatments are effective, but only for certain populations. In Miguel's case, we'd likely want to use TFCBT, which is an evidence-based treatment program, but with certain modifications to tailor it to work with someone his age. Okay, and then finally, termination should also be evidence-based. We want to know which practices in termination are going to be best to help reduce the likelihood of treatment relapse, and so that our clients don't end up coming back needing therapy all over again, right? Which, I mean, that happens sometimes, but we want to use best practices in termination, all right? Okay, so now to kind of end this here, why use EBP? There continues to be a lot of resistance to the use of EBP in therapy. Therapists like the freedom to conduct therapy as they like. And a lot of emphasis on theoretical orientation without really understanding how to use EBP with a particular theoretical orientation makes it seem as though you can't have your own style or your own orientation while also being evidence-based, when in fact these two things can very much go together and help each other. It does also take time to locate and read the latest research, and you do have to be intentional about staying on top of new and emerging research, right? So that kind of starts to explain why there is a bit of resistance and it's not as common of a practice as it should be. But that being said, we need to remember that our ethical codes do direct us to keep up with scientific evidence in order to provide clients with the most effective treatment possible, and EBP is the best way to do this. Your book provides some helpful ways to think about why it's important. Consider, for example, if you have pain, chronic pain, and two friends recommend two different interventions. One says acupuncture and one says a chiropractor. Both of these are kind of scary when described, right? One sticks needles in you and the other cracks and manipulates your bones. So before you pick one, what might you do? Well, you're going to do some research on its effectiveness, right? And that's being looking at the research, the evidence base, right, for it. And that may be reading reviews, looking at articles, lots of different things. You might also gather some anecdotal evidence by asking other people what their experience has been, including your friends. Then you're going to consider maybe risks, benefits, and costs, looking at those special circumstances, right? And your own wants and needs and your own characteristics, right? And then you're going to make a judgment, right? A decision about what you're going to do, right? And so again, we're doing this on a daily basis. I mentioned in the previous lecture that you're doing this when you're picking a restaurant, for example, and that's fairly simple, right? So it makes sense that if we do this with more simplistic things like picking a restaurant, that we'd want to figure out what the best way is to help someone who is struggling in therapy, right? So while it can seem intimidating at first, it is worth taking the time to learn how to do this well. And because of that, you're going to practice identifying ways to use EBP during each stage of therapy during class this week and as we continue to move on throughout the semester. All right, so just a little intro to it. So let me know if you've got any questions. We'll continue to discuss in class. Thanks for listening.